Back now on the town hall with some updates on the Omicron variant, including the first major real-world study of that variant of the coronavirus.
We've been hearing from experts here on the town hall since late last month that it could be a few weeks before we started getting this information, but now we do have some. The analysis released by South Africa's biggest healthcare system found that the risk of hospital admission from Omicron seems to be about 30% lower than with the Delta variant. Now, the experts behind it say that could be because it causes less severe illness or because the country has had so many cases that many people have a natural immunity already.
The study also found that Omicron is more resistant to the Pfizer vaccine. 2 shots gave people 70% protection against hospitalization versus about 90% protection against the Delta variant. The head of the CDC, Dr. Rochelle Walensky, told the Today Show this morning that this really backs up what we're seeing here in the United States. And she points out that even if it's less severe but more transmissible, that would still add up to a big issue for hospitals.
We're starting to see some early data that is just demonstrating some decreased severity, shorter lengths of stay, exactly as you said, fewer people on oxygen, fewer people in the ICU. But I also want to emphasize that if you have more and more people who have disease, even if you have fewer people that get sick from it, you still have a lot of people who are getting sick. So really, we want to make sure that we keep all those prevention measures, vaccination, boosting
I
in
think
place.
what's confusing.
Dr. Walensky there says that Delta is still the dominant strain here in the U.S. Omicron makes up an estimated 3% of the new cases nationwide, and as much as 13%, though, here in New York.
We also have a completely separate study from Pfizer, which the company says confirms that its COVID treatment pill is effective at treating the virus. The final numbers from Pfizer's trial of the drug called Paxlovid show that it's 89% effective at preventing high-risk people from being hospitalized or dying from COVID. That's in line with the initial numbers that were released last month, though the actual data hasn't been released so that it could be reviewed just yet.
But it is much more promising than Merck's drug, which was only found to be 30% effective and hasn't been authorized yet by the FDA. The FDA still has to schedule a meeting to review Pfizer's drug, so of course we'll keep you posted on that. And experts say it's possible that if Merck's drug is approved, that approval could be withdrawn if and when Pfizer's pill gets approval. A lot of info. Coming up on today's town hall, Buffalo's superintendent wants to give administrators in the school district some big raises. We're going to talk with our investigative Post partners about just what's being proposed with taxpayer money.
Plus, we'll get a check of your forecast. You're watching our daily town hall. We'll be back with more right after this.